I was born in Newcastle, which is a town about 100 kilometres north of Sydney. Didn't stay there very long because my parents then moved to Sydney, and I spent all of my time growing up really in Sydney. So I went to Sydney University. I did my medical degree there. I did all of my training in internal medicine and medical oncology there. I did a master's and a PhD after that, and it wasn't until I was completing all of my training that really an opportunity presented itself to come overseas. Thought I had something lined up back in Sydney, and for 6 months I'd had conversations about when the job would be approved, and all of a sudden they started saying the word if, and I stumbled across a job that was here in Hamilton at McMaster University. And McMaster University really was very internationally recognised. I had done training in clinical epidemiology, and McMaster was one of the leaders in that. In fact, one of the people who really was a leading writer in that area, George Broman, had been the CEO here in the Cancer Centre. So in fact, he was one of the people who contacted me when I showed interest in the job. So it was really a chance event. When I was training in internal medicine, I was trying to figure out what I really wanted to do. And in some ways it's easier to decide what you don't want to do. And I didn't want a specialty where people would come and go and you wouldn't have an ongoing relationship with them. And I saw oncology as a field where I would have an ongoing relationship with patients, that I would sort of see them over time, that I would be able to help them a lot. And it sounds corny in a way, but I sort of am very strongly motivated by the need to help people. The most satisfying parts are in some ways some of the most challenging parts as well. So I see people who have a lot of illness, who are faced with a lot of challenges, that have lots of problems including pain or shortness of breath. And I think that one of the most satisfying things about that is being able to help people. Being able to offer them treatment that might either reduce their suffering or their symptoms, or in fact improve their cancer and improve their overall well-being. So that to me is one of the more satisfying but yet challenging parts of my job. I think one of the more difficult parts of my job is to be able to sit down and talk to people when things are not going well. I treat lung cancer, and unfortunately it's a disease where people often have advanced disease when they're diagnosed, and many of the people that I see ultimately are going to die from their disease. And so to sit down and talk to people about the fact that their treatment isn't helping, that perhaps they have a more limited time to live their lives, can be very hard.